Hello all, I am Dr. Kartikeya Bhargava and I am a Senior Director Cardiac Electrophysiology and Pacing at Medanta the Medicity Gurugram. Today in this video, I will be talking about sudden cardiac arrest, sudden cardiac death and cardiopulmonary resuscitation or CPR. Now, sudden cardiac arrest, as you may have heard, that many people who are fine one moment and suddenly collapse and then die. At times, it is often labeled as heart attack, which is different from sudden cardiac arrest. Now, let's understand what sudden cardiac arrest is. Now, we know that heart is a pumping chamber of the body, and it pumps blood to all the organs of the body, including the brain. Now, if for any reason the pumping efficiency stops immediately, the blood flow supply to all the organs, including the brain, is stopped, and that results in loss of brain function, suddenly resulting in loss of consciousness. Now, sudden cardiac arrest is a situation in which the heart's pumping effect suddenly stops, and so the blood is not pumped to any organ of the body. And since the brain also doesn't receive the blood, the brain function stops immediately, resulting in loss of consciousness. And if not promptly treated, immediately action is taken, the person who suffers a sudden cardiac arrest can die. Now let's see how one recognizes sudden cardiac arrest. Now, if you find that somebody is collapsed and probably not conscious, one should assess whether the patient has suffered a sudden cardiac arrest. To assess that, there are three things then one has to look for: whether the patient is conscious or responsive. To do that, one needs to shake the person gently to see whether the patient shows any response or not. Just shouting loudly may not help, because the person may actually be conscious but may be hard of hearing and may not hear your sound. So to shake the person gently while calling him out is important to see whether the patient is responsive or not. If the person is not responsive, then that means that the person is actually unconscious. Second thing to look at, whether the person is breathing or not. To assess for breathing, one has to look, listen and feel for breathing. Now look at the chest. As we know that as any person breathes, the chest expands, and then as the person exhales, the chest collapses. So one should look for chest expansion, and that is best done when the eyes are at the level of the chest, so that to look at the rise and fall of the chest wall, the front chest wall. The second thing one can do is feel the air coming out of the nostril using the fingers, placing your fingers just outside the nostril and see whether you can feel the air coming in and taking into the nostrils by the person. If there is no air going or coming out, that means the person is not breathing. Third thing one can do is look for the air coming out of the nostril. Now for that, one can bring your ear close to the nostril of the person and look for if there is any sound of breathing, whether the air is coming out or not. One can listen for that sound. So if look, listen and feel suggest that the person is not breathing, that means no breathing and the person is unconscious by looking at the responsiveness. Third thing one can look at is looking at the circulation, and to do that, one has to check for the pulse, and typically we check in the neck region. Just place your 3 fingers or thumb in the middle of the neck at the level of the Adam's apple, and if you can see a pulsation, that means the person pulse and the heart is contracting. But don't waste too much time in assessing that, because for lay persons it may not be very easy to look for the pulse. But if you do not find any pulse within the 10 seconds, that means the heart is not contracting and there is no pumping function of the heart. So if the person is unresponsive, he is not breathing and there is no pulse, that means the person is suffering from sudden cardiac arrest, and then one has to take prompt action in the form of cardiopulmonary resuscitation or CPR. And once a person who is suffering from sudden cardiac arrest, a lay person who has witnessed that, has recognized that the person is having a sudden cardiac arrest, then one needs to take a prompt action. And the prompt action is in the form of cardiopulmonary resuscitation or CPR. Now, what it means is that one has to restore the circulatory function, breathing function of the person, by giving artificial respiration and artificial chest compressions. Earlier, chest compressions were secondary, and the primary way to give CPR was by giving artificial breaths. But now what is recommended is chest compression are the most important aspect of CPR. And if one is not comfortable doing mouth-to-mouth breathing, they can actually skip that. Just chest compression alone may be sufficient even to have the breathing function of the person. Now let's see how to give chest compression. Now, to give a chest compression, the person who has suffered a cardiac arrest should be lying on a flat surface like a road or on a wooden plank, and the person who has to give CPR should be lying on one side of the body. Now, identify the breastbone and look at the lowest point of the breastbone, feel the lowest point, and about 2 finger breadths above that, you have to place the left heel of the left hand on the top of the breastbone, just 2 centimeters above the lowest point. Place your right hand above the left hand and interlace your fingers, and then with your elbows remaining straight, your weight should be transmitted, your shoulder should be just above the breastbone, and then as you compress, the whole of your body weight is transmitted to the chest of the victim. So with this movement, you see how I do a chest compression. You see that the elbows are straight and the shoulders are just above the breastbone, and whole weight of yours is going to be transmitted to the chest of the person who has suffered a sudden cardiac arrest. Now, at what rate and what speed one should give that, and how much compression is to give it. So it is recommended that you should give a compression of an amount, or your force should be such that the chest depresses by about 2 inches or 5 centimeters. That is very important, because if you do give less, then the effective circulation will not be maintained. Secondly, the rate of your compression should be about 100 to 120 beats per minute, and you can just give a count and then see that you are giving it at a right speed. So let's see how to do this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this is how you give it. And if you are also giving mouth-to-mouth breathing, then you can actually give it in a ratio of 30 chest compressions for 2 mouth breaths. But if there are 2 rescuers, one is giving mouth breathing, the other is giving chest compression, then there's no need to interrupt the chest compressions, because they are the priority, and you can give it continuously while the other rescuer is giving mouth-to-mouth breathing. Now, sometimes when we do these chest compression, one can actually break the ribs of the person, but don't worry, because this is going to be harmful. But more important is restoring the circulation in the person's body, which can make the person survive of this sudden cardiac arrest. Now, how long to give these chest compressions? Now, till the person regains consciousness, shows some signs of life, or a medical help arrives with the paramedics or doctors. Till that time, or if long time has passed, for at least 40-45 minutes that you are giving chest compression, but there is no response at all, then one can stop chest compression. But best would be till the medical help in the form of physicians or paramedical personnel who arrive, and then see whether the person is likely to survive. They can take over and give advanced cardiac life support. In the other hand, if they think that the person is not likely to survive, then one can stop chest compression. So this is what is chest compressions, and sometimes now it is recommended that you may not give mouth-to-mouth breathing at all and give CPR only with chest compressions. We call that as chest compression only CPR, and that is what one can safely do if the person who suffered a sudden cardiac arrest is not known to you, is not a relative of yours, or you are not comfortable giving mouth-to-mouth breathing. If at all you want to give mouth-to-mouth breathing, let's see how we do it. We need to take deep breath in your own body, and then holding the breath, you pinch the nostrils of the person, open the mouth, and then bring your mouth close to the mouth and seal the mouth like this, and then exhale rapidly into the patient's mouth. Remember also at the same time your nostrils of the person should be closed because the air should not come out of the nose. Also look for the rise in the chest of the person in telling you that the breathe at you whatever you are breathing out is actually going into the patient's lung. All these are signs that you are giving effective mouth to mouth breathing. If required, you can also place a handkerchief between your mouth and the person's mouth, and there are other devices which are available through which you can give it more safely without any risk of infection, but they will not always be available with you. So this is about mouth to mouth breathing and chest compressions. Now these are very important, and remember that you may be the only one between the life and death of the person. If you have recognized or seen a person having a sudden cardiac arrest, and then you have recognized that the patient truly is unconscious, is not breathing, and does not have a circulation, doing CPR promptly can actually save that person's life. Remember that every second lost is actually decreasing the survival chances by a lot. So you have, don't, without wasting any time, one has to start CPR immediately and till the medical help arrives.